Welcome to the Be Well Collective, a refreshingly grounded podcast dedicated to separating health fact from fiction, offering listeners access to credible, science-based conversations on a wide array of health topics. Each episode features discussions led by medical professionals and experts, providing listeners with the evidence-based insights to navigate the often confusing world of health and wellness with confidence and clarity. Now let's nourish our minds and get into it. Hey, and welcome back to the pod. I'm Sara Hillring, your sport and clinical dietitian, and I'm joined, as always, by our favorite co-host and mental health therapist, Riley Speth. How you doing, Riley?
I'm good. What's up, Sarah?
Feeling inspired today, so I'm going to run with that. Riley, what is our topic of today?
Today we're going to be discussing strength training, its impact on our health, and its intersection with nutrition and mental well-being. So that's what we're covering today.
Excellent. Yeah, so strength training has had a surge in popularity amongst the public. You hear about strength training for often individuals utilizing GLP-1s, so weight loss medications. For those in the menopausal phase of life, strength training has really been a hot topic and really has taken off. And then if you're a social media user, whether it's TikTok, Instagram, YouTube, there are a lot of influencers out there providing content on how to strength train. I think amidst all of that, though, it can still feel really overwhelming. There's a lot of information, and there are still quite a few barriers to entry that occur as a result because typically there's still a lack of fundamental education on how to strength train. And that's really key. And we'll get into that today of why a foundation is really important. And then there certainly are still misconceptions surrounding the value and the benefits of strength training for different groups. So we're going to dive into all of this. So don't you worry, we're going to get to it. We're going to unpack some interesting research in the current landscape, which is always my favorite. I love looking into the literature. And as always, we are here to provide credible information and a breakdown of the scientific legitimacy to today's topic into those nice digestible bits. We want to make sure it makes sense.
Exactly. Well, I'm looking forward to digging into this more. Before we welcome our guest, Sarah, would you do us the honors of welcoming this topic and setting the stage, telling us a little bit of the history on strength training?
Of course, you know I love a mini dive into the historical context. As much as I love science, I also really enjoy history. So, to give us a little bit more understanding of the beginnings of strength training, it has a pretty extensive history, which I find pretty cool. It goes back to ancient civilizations, right? So there's evidence as far back as 2040 BCE that depicts soldiers, athletes of the time using weights or having to pass stone lifting tests. I have like the best mental image of people doing that when I was reading this article about it. Then you move into the Middle Ages and the Renaissance, where there was a renewed interest in classical Greek ideals of mind body health. And you have physicians that are starting to recommend exercise with weights. And then we transition into 1896, so quite a bit later, and weightlifting becomes part of the first modern Olympic Games. If anyone is an Olympic fan, I so very much am. So I love the history of this. This is where weightlifting becomes a permanent Olympic sport with standardized events in 1920. What's interesting, and most of us probably don't find this too surprising, is that these developments do not include women, and we'll get to that later. Then the 1950s and 1960s arrives, and notably in the Eastern Bloc. So think of this as the Soviet Union when that was in existence, the Cold War era, which is quite a long period of time in history. There began the use of systematic training cycles known as periodization to enhance performance. Periodization is really interesting if you're in the exercise world and space. And then those alive in the 1970s will remember that there was this bodybuilding boom fueled by figures like Arnold Schwarzenegger, definitely a pretty prominent individual that made weight training a lot more mainstream. Unfortunately, the historical context with strength training for women has been a little bit more challenging. So we mentioned a quick intro to that earlier on with the Olympic Games and the institution of strength training. But that being said, for women, there's been a lot of societal barriers. There's been a lot of challenge to challenging the traditional views of what femininity looks like. So for much of the 19th and early 20th centuries, women were discouraged from strenuous activity due to fears of appearing too masculine, having harm being caused to reproductive health. So instead, their fitness regimens centered more around light calisthenics, dance, aerobics. And then with the passage of Title IX in 1972, woot woot, we love it. We saw this increase dramatically happen in opportunities for women in sports, providing that critical boost for competitive lifting to become what it is today. So past always influences present, of course. There's still a lot of lasting ramifications from barriers for women and entry into sports. So we do see still challenges with accessibility and education surrounding strength training. Luckily, that's starting to change, and we'll talk about that later today.
It's so wild to think that strength training goes all the way back to ancient civilizations. And so cool to see that it was the first in the modern games. But I mean, it doesn't really shock me that women weren't included. And it's been such a journey for us. I
Mhm.
mean, as a woman myself who recently took up strength training, probably about a year ago, I really feel those old norms and cultural components. I personally grew up with the idea that cardio was for girls and weightlifting was kind of just for the guys, right?
For sure, yeah.
So at first, walking into the weight room, it was really hard for me and super intimidating. Gym I go to is definitely not a 50-50 gender divide when you go to the weight room. Usually I'm within the minority as a woman. After some time, I feel strong. It's empowering. I really love strength training.
Mhm.
It's just taken a while to get there.
Absolutely.
Hearing the history, it makes me appreciate how far we've come, but also how much work there still is to do to make strength training accessible, like the education that's based around it, and then just kind of normalizing it for everyone. So, anyways, thanks for that, Sarah. Now that we've set the stage for things, let's welcome in Katie Jensen into the studio. Katie, we're so excited to have you here.
Oh, thank you guys so much for having me on the pod. I'm excited to be here.
Welcome.
Oh, thank you. Thank you.
It is my pleasure to introduce Katie today. Katie received her bachelor's degree in health and kinesiology from the University of Utah in 2022 and has been working in the corporate wellness space ever since as an exercise specialist. She received her ACSM Certified Personal Trainer CPT certification in 2023. She's worked as a physical therapy technician and has supported several different companies as an exercise specialist since graduating and loves working with people to help them achieve their health and wellness goals. Katie's been working at the ARUP Health and Wellness Center for a little over a year now. In her free time, Katie enjoys traveling, reading, spending time with family, and spending time outdoors. Katie, we'd love to hear from you. Tell us a little bit more about yourself and your background into strength training.
Yeah, absolutely. So I actually started strength training when I was about 15 years old. So I've been doing it for a long time. Yeah.
15?
Yep. So it's been 11 years at this point. It's something that I have always actively loved. It was kind of where I fell into fitness and fell in love with fitness. So it's a really special and close to my heart mode of exercise, essentially. I really enjoy free weight training and barbell training, and I've been lucky enough to gain plentiful experience in crafting and scaling exercise programs through my career, working with people from like deconditioned individuals all the way up to more athletic populations. And so I've had a lot of exposure to it in my personal life and in my professional life. With my bachelor's degree in health and kines from the University of Utah, I was able to learn a lot of really great techniques for strength training, and I learned a lot from my continuing education with Exos when I worked for them. I'm currently the exercise specialist here at ARUP, and I've been in the exercise field for about 8 years.
Dang, you've been doing this a while. I didn't realize that. 15 years.
Mhm. That's impressive. I didn't know that about your history either, that you started as a youth. That's very cool.
It's always been really fun and one of my absolute favorite things to do.
Well, thanks again for being here, Katie. As always, we kick off the episode with a snack that we brought in. So, Katie, would you like to share? Did you bring a snack today?
Absolutely. Yeah, I brought in apple chips. Arguably not my best choice for a podcast format, but that's okay.
That's okay.
Still delicious.
They're the best, honestly. They're so good. They're, like, super portable. A great hiking snack. Love it. What about you, Riley? What'd you bring?
I brought a little cutie.
Ooh,
So good.
Mandarin orange? What's the difference between a mandarin orange and a cutie?
I think the cutie is the brand name. I had this discussion the other day, and the mandarin orange is actually what it is.
Got it. Okay, perfect. And Sarah, what did you bring?
I made overnight oats.
So good.
Always a favorite, always an easy thing to do. And it's a apple crumble, and it's fantastic. Highly recommend. If anyone wants the recipe, let me know.
Absolutely.
Katie's saying yes, perfect. Well, I'll share it in post. Fantastic. Well, thanks for indulging us in that. It's just always a fun way to kick things off and see what people gravitate towards food-wise. Now that we have this stage set, let's get into it, yeah?
Yeah, let's do it.
Okay, let's go.
Well, let's first bust some common myths surrounding strength training. I'm going to go through some common ones that we often see circulating. You need to lift heavy to get results. It makes you bulky. You can only lose fat mass through cardio training, not strength training. You can only see progress when working out every single day. Strength training can be dangerous for you. You will lose flexibility if you lift weights. Boo, we don't like
Yeah,
those.
we don't like any of those. Katie and I are making gestures off camera that were like, oh, this is so inaccurate.
Yes. Katie, can you speak to each of these and kind of just break down why these are wrong and why the evidence shows that none of these statements can be quite accurate?
I would love to bust some of these myths. First and foremost, you need to lift heavy weights to get results. This is very inaccurate. While it is true that you will see your best results by following progressive overload training, which is essentially subjecting the muscle to overload or a greater stimulus to continue to increase muscular strength and mass, lifting heavier and heavier weights is not the only way to do it, right? So we can progressively overload with things like increasing our repetitions, increasing the sets that we're doing, and increasing the intensity to improve your muscular strength. You're still going to get stronger. It's just using a different modality, right?
Mm-hmm.
Generally speaking, you don't actually need to lift any weights at all, right? You can do body weight training and still see improvements with strength training, especially if you're deconditioned, right? If you're just first jumping into this, you're going to have a lot of really great strength gain and muscular growth with just body weight and starting to get the body moving and learning how to do some of those strength training movements without the external load. There are many individuals who complete body weight strength training and do see significant muscular strength improvements. Now, the caveat with body weight strength training is that in order to have your muscle continue to grow and increase in size, what we call hypertrophy, you actually need to progressively increase your resistance. Now, how we're going to do that with body weight training is by doing harder and harder progressions. So think calisthenics here. So instead of like a body weight sit to stand where we're sitting down on a chair and we're standing back up, instead, maybe we're standing up, we're removing that chair and we're sitting our hips all the way down and then coming back up from there. So there's ways to make things harder without bringing in external load, which is really nice. Harder variations of bodyweight exercises need to be utilized to continue to build your strength. Resistance training intensity and the number of sets and repetitions, just generally speaking, are actually inversely related. So the greater the intensity or resistance, so the amount of weight you're lifting, the fewer number of repetitions that you actually need to do. So let's say you're doing bodyweight training, you're going to need to do higher sets and repetitions to get the same results. If you are at the absolute maximum resistance that you have available to you and you need to continue to progress yourself, you're going to need to increase those repetitions. Anybody can do it without lifting heavy weights. So that shouldn't be a barrier to entering that field and actually getting into strength training.
Absolutely.
So next myth that we have is that strength training can make you bulky. Resistance training does not always necessarily make you bulky or gain a lot or excessive muscle mass, right? That's what we're talking about when we're talking about this bulky myth. Resistance training improves your muscular strength and endurance, but to hypertrophy, right? So to gain that muscle mass and get it to an excessive point, meaning bulky bodybuilder type physique, it actually requires a really specific training and nutrition program that must be followed.
Mm-hmm.
The only way that muscle mass is gained to an excessive degree, where you're not following that very strict program, is through exogenous hormones. And we never recommend that. It is incredibly harmful to your health, your physical health, mental health. I mean, all of it. It is so detrimental for you. Sarah, I know that you can tell us a little bit more about what kind of a routine would have to be followed in order to garner results like that from a nutrition standpoint.
You have to be really specific with your macronutrients. So it takes a lot of time and intention. You're usually counting your macros, counting calories. You have a very set number of protein, carbohydrate, fat. Those are your macronutrients if you didn't know what those were. And it's pretty rigid. And so you often are really structured and really intentional, I suppose, in a way about what you're doing with those macronutrients. So usually it's a pretty finite menu for a lot of people. Typically, when it's competition day, there's a lot of dehydration going on. There's a lot of underfueling. There's a lot of lack of carbohydrates day of so that you can get that musculature to pop. That's the intention if you're doing a swimsuit competition, a bodybuilding competition. That obviously has a lot of ramifications that's not super helpful for the body. So it takes a lot to get there. So it's a really good aside to talking about why that misconception of getting bulky is really hard to achieve, one, and is likely not going to happen for individuals that are looking to get strong, looking to move their body, looking to get into strength training. So hopefully this conversation dissuades any fear surrounding that.
There's another portion to this, right? Where those who are assigned female at birth, who are not currently on any HRT or hormone replacement therapy, as prescribed by their physician and managed that way, actually have lower circulating levels of testosterone, which means that women already have a more difficult time putting on and building muscle mass to an extreme degree. And so they are even less likely to have that issue of excessive muscle mass if that's something that they don't want.
Mhm.
Again, that likelihood is fairly low that you're going to get to a bodybuilder or something with like really, really excessive muscle mass without having, again, a very, very structured routine like Sarah was talking about. And it often takes usually hours in the gym in order to achieve that. Yeah, the likelihood of getting muscle mass to that degree is low.
When I started going to the gym, I even remember my partner was really pushing for strength training, and that was even something that was kind of a misconception for me because I was like, "Well, I don't know if I want to get bulky."
Sure.
And so it really took quite a long time for me to break that barrier in my brain to say, like, that is not necessarily the case. That's not going to happen. But yeah, it was just interesting. So thanks for chatting about that.
Absolutely. Yeah. Another big portion of this, and I don't know about you guys, but I'm speaking from personal experience here, is that anytime I heard about strength training, muscle building, things of this nature when I was a lot younger, you would consistently see advertisements and things on TV where it is these bodybuilder type individuals going around doing their strength training routines, and you never really saw representation of what a woman who trains consistently and strength trains would look like with that similar regimen or routine. And so it was this mental shift. Women can be in this space. Everyone is welcome when it comes to resistance training, and everyone can benefit. Like, it is so, so good for us. And so I totally understand where you're coming from, Riley, in that we have these preconceived notions of what strength training may be. And that's something that does happen quite often with this.
Yeah.
And that's not to say that excessive muscle mass can't be of concern to certain people. That's absolutely fair. And if it is of concern to you, you can always cap your strength training. We can always say, oh man, my biceps are looking great. This is where I want to stick around. This is where I want to stay. And you can just enter what's called a maintenance phase. So that means that we're staying with our resistance, we're staying with our sets, and we're staying with our repetitions that we're currently at to maintain the muscle mass that I've gained, maintain the strength that I've gained, but to stop that process of hypertrophy. And so you can always just go to the point that you want to be in that physicality or strength that you want, and you can hang out there. There is no reason to continue to push and continue to hypertrophy if you're already where you need to be. The other little fun tidbit that I'll kind of throw in there is that the ACSM does have a specific section on this. They say to improve muscular endurance rather than strength and mass, so getting how many times can I lift a weight in a row increased, is using a higher number of repetitions. So think 15 to like 25 repetitions, really, really high repetition, could be performed per set with lower or shorter rest intervals and fewer sets. So maybe like 1 to 2 sets, somewhere in there. This regimen necessitates a lower intensity of resistances, typically no more than about like 50% of your 1 rep max. And so that's another way to mitigate it if you are really concerned and still strength train. But keep in mind those things that we talked about before, like the likelihood that we're going to get super bulky is quite low. So, our next myth is only losing fat through cardiovascular training. This is false. Cardiovascular training is extremely beneficial to body recomposition. It is fantastic. And fat mass loss, right? It's really, really helpful for that. But resistance training also plays a crucial role in supporting this process. So, resistance training has been shown to improve our metabolic rate, improve blood sugar regulation, and what that essentially comes down to is, and Sarah can speak to this a little bit more in depth, but blood sugar regulation can actually help to get your body composition into a better range.
It is really cool the impact that we're seeing in different studies, and what happens with resistance training is that you're getting this recruitment of GLUT4 receptors that uptake glucose, right? So they accumulate in greater quantity to the surface of different areas that uptake glucose, which is a lot of organs in the body. There are different organs where we primarily store glucose as glycogen. That's our storage form. And it's pretty cool, right? It's uptaking more, so it's pulling it out of the bloodstream, right? Out of the systemic system, and it's pulling it in so that we have better regulation and we have less free floating glucose within the body. So, what happens is you get an improvement in insulin resistance, you have less high of an A1C, and you get to see body composition changes happening more readily because that metabolic profile is improving. I just think that's incredibly fascinating on that small level, what the muscular can do in terms of changes when we put load on it when we do resistance training.
Generally speaking, these benefits that are provided with resistance training can help increase our muscle mass, and that in turn increases our metabolic rate. And that can help with that body recomposition piece that people are looking for when they're going into the gym and they're exercising. So it's really important that these benefits to resistance training actually help lead to fat loss when they're combined with proper cardiovascular training and nutritional strategies. So, a really good individual to talk to on this would be someone like a dietitian. They can really help zero in on those nutritional strategies to support what you're doing in the gym. But from an exercise perspective, resistance training plays a very key role. Our next myth down the line is you only see progress when you're working out every single day. This is something that I hear a lot, but it is false, and on the contrary, it can actually be detrimental to exercise every single day. Our body needs rest. It is so important to give your body that time to rebuild and recuperate after a really tough exercise session. Generally speaking, we really recommend that you push yourself quite hard. When you are doing resistance training, it's important to tax those muscles and essentially initiate that process of muscle rebuilding. So, with strength training, the ACSM really only recommends strength training 2 to 3 days per week. We want to see that you are having rest in between each session to rebuild the muscle tissue after you've broken it down via strength training from previous day. So very, very important that you have those. Now, let's say you're an individual that absolutely loves resistance training like myself, and you're like, man, I want to get this in more than twice a week. That does not feel like enough for me, and it's helpful for my mental health. It makes me feel better. Amazing. We can still do strength training 4 times a week. The catch there is that we would do an upper body strength training day and then a lower body strength training day. Give us a nice rest in the middle. So one extra day, give it that 48 hours of rest time to recoup, rebuild, and then follow it up with an upper body day and a lower body day. This gives us 4 total days of strength training, so we can still get in the gym and crush it. It's awesome, but it gives that body the rest that it needs. So, rest is super essential for resistance training because it allows the muscle fibers to recover and rebuild. And if you strength train the same muscle every day, it's never going to have a chance to recover because we're breaking, never building. Very, very important. In order to gain that strength, in order to have muscle hypertrophy, you have to take a break. Super important. So, give yourself that time to rest. And if you're still excited and you want to go out and do something, go do cardio. Go enjoy like a hike or a walk. Get out on a bike ride, do something fun. And then get back into the gym when you feel ready. And I mean, yoga, stretching, super, super key. We'll get into that a little bit later, but you could do those on your off days as well. All right. Next myth is going to be strength training being dangerous. Now, I understand where this myth comes from because with a higher degree of activity, moving, getting the body out there, lifting heavy weights, it could seem like that's going to carry a greater risk for injury. Absolutely, I understand that. But The risk of musculoskeletal injury is actually higher in those who participate in contact-based physical activity than those who do not. So this is going to be your football players, rugby players, sport players, right? Individuals who are out running, they are out doing like track and field, different things like this, where we have a lot of load and repeated strain on the body. You're going to see more risk of musculoskeletal injury in these cases. But if you're going for walks, if you are lifting weights slow, controlled, in proper form, the risk goes down significantly with this. The risk for developing a musculoskeletal injury, according to the ACSM, is inversely related to physical fitness level. So, for any given dose of physical activity, individuals who are physically inactive are more likely to experience a musculoskeletal injury when compared to their more active counterparts. The more that we exercise, the more that we get out there, the more that we strength train, the less likely it's going to be that we're going to get an injury. Super, super key that we can decrease our risk by becoming more active. And so, another method to help reduce that risk is going to be stretching after your sessions. Stretch that body out, let yourself get recovered, and make sure that we are continuing to have good length in the musculature. Getting a proper warm-up. I cannot stress this enough, you guys, that proper warm-up. So important. Louder for the people in the back. We need 5 to 10 minutes at minimum of that warm-up, okay? So get out there, get onto a bike. You could do some walking. You could do just some really light repetitions of whatever exercise you're going to be doing to get that body ready for the activity that you are going to be participating in. This is true for cardio. This is true for resistance training. So just make sure you do that. Having a proper cool down is also going to be massively beneficial, because if we just stop, cut that activity off, our body's like, wait, oh my gosh, it does not have that transition period to come back down into resting and baseline measures. So super important that you get both of those in, and they can help to decrease your risk of musculoskeletal injuries. Really, really, really important. The other thing that's really important is proper exercise progressions, right? So if we have never lifted weights before, and we jump into the gym and we try to grab a barbell and do chest press and back squats and different things like this, the likelihood of us getting injured does increase, because we are doing it at too intensive a level that our body is not equipped to handle yet. Okay, so you always want to work through with proper progressions. Now, a personal trainer, an exercise physiologist, a PT, all of these people can really help you get there and progress appropriately. Contact those individuals, or you can look up some resources online on how to properly progress that exercise. The ACSM has some really good resources on that as well. So those are the risks, and that's where this fear comes from of exercise being dangerous. Now, if we compare that to the list of benefits of strength training, oh boy, you can really, really see how much that is important. So I'm going to go through just some of those benefits. Generally speaking, one of the best things that we can do for our bodies overall is going to be strength training. So the ACSM says that we can improve our cardiometabolic risk factor profile. It can lower the risk of all-cause mortality. There are fewer cardiovascular disease events in those who are meeting ACSM recommendations for resistance training. We have a lower risk of developing physical limitations, so not being able to reach over the head, not being able to squat down and grab things as we age. We have a lower risk of non-fatal diseases, so type 2 diabetes, different things of this nature. Resistance training also helps to improve the blood lipid profiles of individuals who are overweight or obese. Resistance training also positively affects walking distance and velocity in those with peripheral artery disease. Exercise that enhances muscle strength and mass also increases bone mass, so bone mineral density, and bone strength on those specific areas that are stressed during your exercise session. So squats are really going to help with the femur bone mineral density, so at the neck and head of the femur. Bone mineral density is so key, because as we age, right, especially for women or those assigned female at birth, we have menopause. And as we go through menopause, we get this huge decline in bone mineral density. So by strength training, you can actually attenuate those effects and make sure that you're staying a little bit higher and protecting your bones. So preventing osteoporosis, which is fantastic. Resistance training also reduces pain and disability in individuals with osteoarthritis. It is used in the treatment of chronic back pain. It can prevent or improve depression and anxiety. It also helps to increase vigor and reduce fatigue. Those benefits compared to the risks that we had, you can see that resistance training is so important, right?
Yeah.
All right, team, last myth that we're going to go through. We have this myth of losing flexibility if we lift weights. This is not the case. You are not going to lose your flexibility by lifting weights. Our muscles are designed to contract and relax. We have to go through that relaxation portion in order to lift effectively. So, when you are doing those lifts, if you are going through your full range of motion, you are going to be maintaining the flexibility that you have. It is really important to note and to say that if you want to improve your flexibility, it's important that you do flexibility training, but you're certainly not going to lose flexibility by resistance training. A really interesting meta-analysis has actually shown that strength training with external load, that being a huge asterisk here, right? So you have to have external load, this can't be body weight, is just as effective as stretching protocols for flexibility training and range of motion, which is fascinating and so cool. Kind of shows the contrary of what we would, in common popular belief, assume. Super important to know that, and don't be worried that you're going to become inflexible if you start doing that weight training. You're going to do absolutely amazing.
That was beautifully thorough. Thank you for answering all of that. I think you just busted every single one of those myths.
Every single one of those we've probably heard before or have maybe thought or believed before. So it was really cool to hear that. Thanks.
I think a really important piece to also get into is when we think about programming strength training, we really think about the individual. Anytime that we are working with a client, a patient, we really have to consider who they are, what their goals are, their stage of life, their background, their health history. All of that matters so much because that's going to be what we take into account to tailor their training. I think there are multiple populations where there's a lot of questions surrounding how do I strength train if I'm in this stage of life. So maybe what we can do is have you give like your top 2 points for each of these population groups, top headers, what would be really like most important to know. You mentioned just previously, I think a good place to start is menopausal women. There's so much more research that's coming out. It's a hot topic for a very valid reason. A lot of the population is making that transition, so to speak. So, what are two top recommendations for strength training in that population group, Katie?
Absolutely. So, for menopausal women specifically, it's going to depend heavily on your current activity level. The first and foremost, if we are currently inactive, get up and get moving, right? That's going to be my number one. Do some body weight activity, body weight movement, banded work. Super beneficial.
Love banded work, by the way.
Yes,
So good.
so good. That resistance tubing, it makes it feel a little safer to do resistance training because we're not trying to like lift up and lug around these super heavy weights. You can use that resistance tubing to get yourself to a higher strength level without the fear behind heavier weights, which is really nice. Leading into that, though, we have my second super important tip for those going through menopause. I would say that heavy resistance training is going to be your number one key. It helps with that blood sugar regulation, and it is so beneficial for that bone mineral density, which is key for that long-term health and longevity.
And what about body composition? Because that's a big factor within menopause. There's a lot of concern about central adiposity. How does
Absolutely.
resistance training play into that?
So resistance training is super beneficial to actually decrease central adiposity, which is fantastic. I'll throw in one thing just as a little bonus nugget. If you are not currently and actively participating in some kind of balance training, I would absolutely recommend it. Because as that bone mineral density, hopefully we can attenuate with that strength training, but it's also important to help prevent fractures in the first place. Get onto some of those really reputable services, working through PTs or online resources, and start working through that balance training now. The earlier you start, the better you're going to do long term.
Absolutely. If there is one resource, there are many out there, just to put that out there. But if there's one resource for strength training that you would recommend for someone that's in the menopausal stage of life, who would that be?
Oh, I would absolutely look up Dr. Stacy Sims. She is fantastic. Her new book, Next Level, is focused specifically in on menopause and training, specifically strength training with that. Her resource is fantastic. Highly recommend checking her out.
Yeah, she's excellent. She does really fantastic research. So, highly recommend that. Let's move on to the next group. Adolescents, kiddos, top 2 recommendations. I think that's a big one for parents. When should my kids start strength training? When is it safe? Because they're growing. Their growth plates are still forming. That's a huge metabolic load to be a growing human. So what would you say to that?
Absolutely. So for our little ones, I would say that the most beneficial form of physical activity that young children can get is playing. Go outside, let them have time outside, playing on playgrounds, climbing safely into trees and getting back down, experiencing some load on the bone with jump roping and things like that. Really, really fantastic for this population. When it comes to resistance training specifically, body weight training and learning how to move the body in space in a safe and effective manner is really beneficial for kiddos as early as 10 years old, even earlier, right? Because it's body weight. When it comes to picking up any kind of external load, so that means grabbing dumbbells, grabbing barbell training, anything like that. Really light dumbbells, maybe until 12 to 13, starting to pick up light dumbbells. 5, 10 pounds should be okay. But we want to save that barbell training for after skeletal maturity has been reached, just to make sure that those kids are staying safe when they're training.
One thing I did wanna add to this is with kids, gamify it, make it fun, make it exciting for them. Kids love games and they love things that excite them and challenge them in different ways. I think adults do too, maybe in some respects, but
Yeah.
one thing we talked about was floor is lava. Using that, Riley, are you familiar with
Yes. Yes, I am.
Okay. Yeah. So floor is lava is a way you can use that and then you can make it into a workout. What it combines is cardio and agility and body weight exercise, and it's fun. Just making sure you remember that too. It doesn't have to look like the way that adults strength train. It doesn't have to be super rigid. Make it fun, make it flexible. That's really what it's all about is just getting kids comfortable in their own body and realizing their own power and their own strength.
Absolutely.
Well, let's kick it to eating disorder patients. That's another common population in all clinical aspects, as well as where we work. So, what are your top 2?
Top 2 recommendations, I would say, is first and foremost working with an eating disorder specialist, specifically a dietitian, to make sure that their nutrition is in a spot that can take external load and resistance training. So, making sure that we're in that place if we are fairly disconditioned, have some muscular atrophy happening, at that point, I would say, as long as you're working with the appropriate dietetics and medical professionals, we can start to work into some body weight training, right? So just getting familiar, just like we were saying, with how to move the body in a safe and efficacious manner. And then slowly starting to work into learning how to lift with those external loads and those external weights as it's appropriate, because it can feel so empowering and so wonderful to learn about your body and understand what can my body do and start appreciating it for what it can give you and what it can provide, which is so cool. And so I think those would be my main takeaways. So working with mental health professionals, dietetics, medical providers, and then just to check in with your progress and make sure that it's not becoming a trigger of any kind. It can be a tough subject and a tough thing to do, but I think that resistance training can be really helpful to get back in tune with the body.
Yeah, I think it could be a slippery slope, but it's not something that's like you can't do it. You just have to be really mindful of why are you doing it? What are you wanting to get out of it? How can it benefit us? And what is the why of why we're showing up and doing it? And so, in conjunction with working with a dietitian or a mental health professional or someone in that space to make sure you're doing it in a safe and contained way.
Yeah, that multidisciplinary approach comes up a lot, and I think there's a reason why it's so valuable. We each add so much to the care of the patient, and this is so true with eating disorders. You need every single person on that team. There is a really brilliant resource that I'd like to call out. It's called the Safe Exercise at Every Stage, or SEES. It's a guideline. It has 3 different domains, one for athletes, one for youth, one for general population. I will attach it in the show notes below, but it helps support a clinician's clinical judgment on what to do and how to scale return to play or activity with individuals that are experiencing an eating disorder. Goes from a level A, we're in the red zone, we need to be really careful, all the way to level D, which we're in the green zone. We're doing okay. We're in remission. So I encourage you to check that out, read it. Remember, it's just a guide to help you as a clinician. At the end of the day, you use your clinical judgment and your fantastic, hopefully, multidisciplinary team to support. But it's really helpful in making sure that we scale exercise appropriately, properly, and we move into resistance training at the proper time, which is midway in that cycle where we've stabilized biomarkers, specifically like cardiovascular needs to be stabilized. That's super key. And we've been able to stabilize general movement like stretching.
Great. Well, let's switch gears. We've talked about different populations and how we should strength train, but I'm wondering, Katie, how do we start? What are some recommendations of how I can get into it? I think it can feel really intimidating, high barrier to entry. How do you make it accessible? How do people get started with it?
That's such a great question. And there's a lot of barriers to entry, just like you were saying. So, how I have people start out, and I have been a broken record on this, but body weight training, learning how to move the body in space, learning how to do those lifts properly, really, really key, really, really important. I have a wonderful resource that I would love to shout out. Tone and Titan on YouTube. They are fantastic.
They are so good. And just to echo
Yes.
that,
Yes. They're amazing and they're so good at helping you really start to learn those basic fundamental movements in order to get yourself into strength training. So, really, really wonderful, really, really accessible. Even if we don't have a computer, a laptop, a device at home, we can always go to a library. If you are a little bit more established in the space, you've been doing body weight training and things like that for quite some time, you can also look up Squat University. They're really wonderful. They're a DPT as well, and they go through some of those more complex lifts. Another really, really wonderful resource is Girls Gone Strong. Fantastic resource for those who want to get into lifting and properly lifting, so that in between zone. So I'd go with Tone and Tighten first for that foundational basic movements, Girls Gone Strong for more of that dumbbell, kettlebell kind of work, and then make your way into Squat University type of lifts. So they're really, really fantastic resources. And I know that there is quite a high barrier to entry, but there are some really wonderful and really reputable resources out there to get to.
absolutely. That's brilliant. That provides a nice progression for individuals. And that being said, we've talked a lot about the benefits of strength training from the physical lens. I think it's important to also turn it towards the cognitive space and its impact on cognitive health. So, Riley, can you break down how strength training impacts the brain?
Yeah, I sure can. So, as I was doing research on this, it was fascinating to me. Strength training can be helpful for so many physical reasons, a lot of those that we've already touched on, but it can actually be really beneficial for your brain as well. First up, let's talk about neuroplasticity. It's your brain's ability to rewire and adapt to things. So, when you're learning new lifts, like maybe like a deadlift or something like that, you're not just training your body, you're strengthening your neural circuits. So, studies have shown that this improves things like memory, attention, and even problem solving skills. So, then there's this thing called BDNF, or it stands for brain derived neurotropic factor. So, BDNF is helping our neurons grow, connect, and stay super healthy. Something cool about it? Exercise, but especially strength training, helps boost our BDNF. Okay, one last brain related explanation in favor of strength training. When you are strength training, your brain gets a chemical boost, which includes dopamine, serotonin, and norepinephrine, which are the big three for mood and motivation. And the good news? There's a benefit for our brain from a single session of strength training. It's not something that we need to wait and do for years and years. And that chemical boost I was talking about, it can start increasing during your exercise or shortly after your exercise, which is super cool and motivating.
That's so interesting. I think something that is thrown around here and there is that exercise can cure mental health conditions like depression. Riley, what does the literature say? Is that true? And tacking onto that, is there one superior type of exercise, whether that is resistance training, whether that's running, whether that's Tai Chi, that benefits mental health the most?
All right, let's get into it. So, research shows resistance training can reduce symptoms of depression and anxiety, sure, but can we cure it? I think that that's a really loaded question.
Mm-hmm.
I wouldn't necessarily say cure, but it can be super effective for our mental health. exercise often improves depressive symptoms and can lead to remission in some cases. But I think that we can think of using it as part of our care plan, maybe another piece to the puzzle or another added layer to our care. We might need to use it in conjunction with medication or psychotherapy or another form of support, right? And as far as one being the best, in my research for this episode, my key takeaway was that all exercise can be beneficial for your mental health, and there isn't really one perfect or better exercise. Do what you love, do what you're drawn to, do what feels good to you. Some things that I was looking up was aerobic exercise, resistance training, and mind-body exercise, think like yoga or Tai Chi,
Mhm.
are pretty effective for treating depression and anxiety. But the takeaway was combining these exercises and practicing what's called a multimodal approach, mixing it up, right? So doing some strength training, but also implementing yoga or whatever feels good to you. Don't just stick to the same thing. That can be what's most beneficial for your mental health.
Agreed.
Enough of me discussing mental health and the benefits. Let's switch gears. Let's talk a little bit more about nutrition. Sara, from your professional and nutritional lens, how does one prepare for strength training? Should I be consuming anything during my exercise, or what do I do after my exercise as far as nutrition goes?
Yeah, all questions Katie gets asked a lot.
Oh, yeah.
And then we debrief often. That being said, let's touch on this briefly. There is a lot of nuance to this, so just take this as general overview. Nutrition is key to unlocking improved performance, right? And enhance recovery. Both pieces are so important. We not only want to perform well, we want to recover well. That is everything to being able to show up the next day and do a different type of movement, or show up 2 days following and hit that strength or resistance training hard and do it well and feel good. Without nutrition, we're at risk of injury. We have lackluster performance. We have all these other ramifications. Nutrition and strength training go hand in hand. They are friends, they are pals. You need both of them, okay? That being said, it's always important to go into a movement session, whether it's strength, which is also known as resistance training, or cardiovascular training, and making sure that the body is fueled. We always want to empower the body with fuel before we start to work out. So, our first substrate that we utilize to power performance is glucose. Glucose is sugar that comes from carbohydrates. Those are key to pre workout. Okay. So, carbohydrates are your focus. The closer we get to exercise, the more carbohydrate focused we want our fuel source to be. And we want these carbohydrates to be easily digestible. We don't want them sitting in the gut. That's not going to feel nice for anybody. No one wants GI incidents or GI issues when they're in the middle of a group class, when they're at a group run, when they're doing whatever they're doing. It's so uncomfortable. So we really want to focus on foods that are lower in fiber. Higher fiber foods are fantastic, but that's not the approach here. That's great to focus on outside of the training space, outside of activity. In this space, different strategies apply. We're thinking more quick carbs, fast carbs, low fiber. Okay, so that's really important to know. That being said, if you're working out, you have less than an hour. Most of us do. Most of us are running from picking up kids, work, school, whatever it is. We're not going to have the perfect idyllic. If we look in the research, we want 3 to 4 hours before that we're eating a balanced meal. It's not always realistic. So I always say top up your glycogen stores, have a snack, make sure you fuel. Consider something like a small smoothie with low fat milk. There's nothing wrong with different types of fat based milk, but when we're getting into the less than 1 hour, that's too much sitting in the gut. Another example would be low fat Greek yogurt with berries, an applesauce packet, toast with jam, or like dates with a little bit of peanut butter. All of those are tolerated and digested pretty well. If you've noticed, a lot of those are pretty broken down. What the main concept is think about as it gets closer to exercise, the smaller and the simpler you want your intake to be. The further away we get from exercise, the more complex, the larger your intake can be, and that can include more protein, more fiber, more dietary fat. So timing, type, and quantity matter, I would really recommend if you're wanting to maximize your training, if you're looking to be more competitive, work with a sports dietitian like myself. They have this important knowledge with how to handle all of those timing, type, and quantity, right? And they can help you meet your individual needs depending on the type, duration, and goals of activity. If you're a strength athlete versus a hardcore endurance athlete, those factors are going to be a little bit different. And then to quickly touch on the post exercise, you really want to make sure you're always trying to consume fluid, protein, and carbs within about 45 minutes of ending your workout. What you really would want to aim for post activity is a well rounded meal. That's going to be most ideal. However, if you're commuting home or you're running off to the next activity, that's usually me, you don't have time for a meal. Refueling the body in a simple, portable way is essential for recovery. Don't skip it, make it happen. So that could be a more dense smoothie. We're talking like higher fat, higher protein, higher fiber. Chocolate milk, a Fairlife shake, cottage cheese, really dense, full of protein. Apples with peanut butter and a rice cake for our gluten-free friends that are out there. And then maybe a well-balanced trail mix, like throw it all in there. The dried fruit, the nuts, the seeds, the chocolate chips, have fun with it. Throw it all in, all foods count. You want to make sure amidst all of this, if it's not a fluid-based snack, you have water with it. We always want to rehydrate. What are we losing primarily? No matter how hard we're working, we're always losing fluid. I always like to mention you never have to earn your food. You always deserve food with recovery. It doesn't matter how long you've worked out. Please don't skip. Please fuel your body. That's so important so we prevent injury so we can come back the next day and do whatever we want to do. So treat your body right, refuel for all the fantastic effort you put into training those muscles. You'll feel better, but you'll also see the training adaptations that Katie's talked about and all those cool benefits actually take effect. That is huge. No one wants to be sidelined by injury. And if you're putting in the effort, you want to see all those benefits come true. So prioritize your nutritional care. That's my soapbox. I'll get off of it now.
Well, Katie, to round out conversation, we would love for you to share one piece of key advice that you would give the audience regarding resistance training, also known as strength training, or perhaps a piece of motivational commentary to support someone who is a bit apprehensive to starting strength training.
My number one all-time piece of advice is to start low, go slow. There is absolutely no reason for us to feel like we have to jump in, be the biggest, the strongest, the fastest in the gym. Absolutely not. All bodies, all people, every single individual is welcome in a gym space, and you deserve to be there. So start low, go slow, go with what you're comfortable with, and just make it happen because you got it.
That was really well said. I appreciate that.
Thanks so much, Katie.
Any other final thoughts before we conclude today? Any takeaways?
I think my takeaway is that it doesn't have to be an all or nothing mentality. I think that I got super passionate about strength training and that became my thing.
Mm-hmm.
Oh, and I hate to say it, but I hate and love running. And so I need to start implementing other things, is what you're saying is that's okay.
Absolutely. Yes. So important to involve all of those different aspects of health and exercise training.
With that, thank you so much, Katie.
Of course.
It's always a joy to connect with you, but really fun to have you on here. You're so passionate about strength training, and it's a space for everybody, like you said. And I think that needs to be echoed louder and said more often. Whether you're a seasoned strength trainer or you're just taking the plunge into it and you're jumping into body weight or bands, remember form comes first. That's a big one we always emphasize. Form is first, foundation is everything. Proper form above lifting heavy any day. Slow and low.
Yep.
Slow and low. That's key. Build your foundation. And you might have called out our transverse abdominis, but remember to get in touch with that from the get-go. Know how to activate it before beginning any movement or lift. That is what keeps us stable and central. And most importantly, progress comes with time. We're not going to look the same as the person that's been doing this for years, and we might be at a different spot than our friend, but progress comes with time. Empowerment builds with growth. I love the quirkiest phrase, motion is lotion for the body. That's my favorite.
Absolutely.
It is though, motion is lotion for the body.
Why have I never heard that before?
You haven't heard that?
Have you never heard that one? Oh,
Oh, we use it a lot in
yes.
the exercise space.
Always, always. Yep.
So don't forget that. Maybe that's people's biggest takeaway from this episode.
Motion is lotion for the body.
Yes. So get out there, move in ways that spark joy. Thank you so much, Katie, again.
Of course.
Thanks,
Thanks,
Katie.
guys. Thanks for having me on the pod. It was super fun to be here.
Appreciate you. And as always, be well.
Be well. Thanks for listening to the Be Well Collective. If you have any ideas for future episodes or questions, please email bewellpodcast@aruplab.com. If you liked what you heard here, rate and subscribe for more. The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. ARUP Laboratory and the Be Well Collective do not assume responsibility or liability for the actions, decisions, choices, or opinions of the individual listener. The content shared should not be used as a substitute for diagnosis, treatment, or medical guidance. Always consult with a qualified healthcare provider before making any changes to your care plan. Listening to this podcast does not create a provider-patient relationship. Use your discretion and take responsibility for your own health decisions. The show is produced by Riley Speth and Sara Hillring. Today's episode was audio engineered by Isaac Acosta Alvarez.